Hi, I'm Jessie Tisdale. Welcome to Be Prepared. Today we'll be discussing the West Nile virus. You've probably heard of the West Nile virus and that it's life-threatening, but do you know how a person would catch it? How would you know if you had it, and what precautions could you take to avoid getting it? Heather Teodoro from the Los Angeles County West Vector Control District will be talking to us about these issues. Hello, Ms. Teodoro.
Hi, Jessie.
Thank you for coming today.
Oh, thank you for inviting me here.
So, first of all, what is the West Nile virus?
West Nile virus is a mosquito-borne virus that can infect mosquitoes, birds, horses, humans, and other animals. So prior to 1999, it hadn't been detected in the United States. Since then, it has spread pretty much throughout the country.
What are the symptoms of West Nile virus?
Well, for most people who are bitten by an infected mosquito, they will not exhibit any symptoms. Approximately 20% of people who do become infected may develop mild flu-like symptoms, which may include fever, a headache, body aches, and occasionally a rash. Oftentimes, this is referred to as West Nile fever. Now, less than 1% of people who become infected may develop a severe form of the illness, which is often called a neuroinvasive disease. Specific types of neuroinvasive diseases include West Nile encephalitis or meningitis. Now, encephalitis refers to an inflammation of the brain, and more severe symptoms include a high fever, neck stiffness, a stupor, coma, paralysis, and on rare occasions, death.
How do people become infected with the West Nile virus?
Well, West Nile virus is transmitted by infected mosquitoes. So a mosquito will first acquire the infection by feeding on a bird that is infected with West Nile virus. The mosquito can then transmit the disease during subsequent blood feedings. So in the case of transmission to a person, the mosquito's salivary glands are actually infected with West Nile virus. And so when she feeds on a person, she can then inject this virus-containing saliva into a person's body.
If you live in an area where birds or mosquitoes with West Nile virus have been reported and a mosquito bites you, are you likely to get sick?
Well, the chances of becoming severely ill from any one mosquito bite are extremely small. So even in an area where the virus is circulating, for most people the risk of developing severe illness is very low. Less than 1% of people will develop a severe form of the disease, and the risk factors include people over the age of 50 or people with lowered immune systems.
Can people get West Nile virus directly from birds?
Unfortunately, there has been no evidence to indicate that someone can get an infection by handling infected birds. However, it is recommended that people take extra precautions when handling dead birds by wearing gloves or using double plastic bags when disposing of the carcass.
Can you get West Nile virus from another person?
Unfortunately, West Nile virus cannot be transmitted from person to person. In other words, a person cannot get West Nile virus by touching or kissing a person who has been infected with West Nile virus.
What can be done to control the spread of the West Nile virus?
Unfortunately, West Nile virus has spread to more than half of the counties in California, including Los Angeles County. So the control of West Nile virus is accomplished through an integrated vector management program, which includes mosquito control, disease surveillance, and public education. The district's disease surveillance program detects West Nile virus activity in birds, mosquitoes, and sentinel chicken flocks. Our mosquito abatement program involves applying appropriate mosquito control measures to known breeding sources in an effort to reduce the existing mosquito population. The Los Angeles County West Vector Control District has also posted these West Nile virus warning signs at local parks and recreational areas in the district to warn residents of the potential of being exposed to West Nile virus while being outdoors. So it's recommended that residents follow these precautions in order to reduce their risks of developing West Nile virus.
So what are these precautions? What can people do to reduce their risk of becoming infected with West Nile virus?
Well, it's important to note that approximately 80% of all mosquito breeding occurs at private home sites, and everyone can do their part in reducing the mosquito population in their neighborhood by removing potential breeding sources on their property and draining all stagnant water. Now, the Los Angeles County West Vector Control District is the lead agency in the control of mosquitoes in this area, and residents are encouraged to contact the district to report any mosquito problems they may have on their property. Another way to to reduce the risk of becoming infected with West Nile virus is to prevent mosquitoes from entering one's home. One way to do this is to make sure that all the doors and windows have proper fitting and tack screens. And another way to do so is to stock all ornamental ponds, unused swimming pools, bird baths, or animal water troughs with mosquito fish. Now, these mosquito fish are effective in controlling for the mosquito larvae because they will consume any developing larvae in the water. The district provides these mosquito fish free of charge, and they can be obtained from the district during normal business hours. Another recommendation is to further decrease your exposure to mosquitoes by going indoors during dawn, dusk, and early evening hours. It is during this time when mosquitoes are most actively feeding. And if you are outdoors, it is recommended that people wear long sleeve clothing and long pants to protect themselves from mosquito bites and apply an effective insect repellent containing DEET to exposed skin.
Should people wear mosquito repellents indoors?
Generally, insect repellents are recommended for use while outdoors. If you're being bitten by mosquitoes inside your home, it's recommended to check around your home for any areas where mosquitoes may be entering. Make sure that all of your doors and windows have proper fitting screens. That would eliminate the need to wear mosquito repellent inside.
Are there any risks due to using repellents containing DEET?
Now, DEET has been effectively studied over the years, and the proper use of DEET has been shown to be safe when used according to the directions. Anyone who is concerned about any risks involved with using insect repellents containing DEET should consult their physician for advice.
Can people use mosquito repellents containing DEET and sunscreen at the same time?
Well, based on information from the Centers for Disease Control, it is safe to use sunscreens and insect repellents containing DEET at the same time. However, it is important that the directions be followed carefully so that the proper application for both products be used.
If you think you have symptoms of the West Nile virus, what should you do?
It's recommended that you contact your doctor immediately. Laboratory tests can confirm whether someone has, in fact, been infected with West Nile virus.
How is West Nile encephalitis treated?
Now, unfortunately, there is no specific therapy for West Nile virus, and antibiotics are ineffective against viruses.
What proportion of people die who get West Nile encephalitis?
Now, less than 1% of people who become infected may develop a severe form of the illness. Among those with a severe disease, fatality rates range from approximately 3% to 15%, and the rates are highest among the elderly. The mortality rate is relatively low in comparison to other infectious diseases such as the common flu. For example, in 2003, there were a total of 264 deaths as a result of West Nile virus in the United States. Now, in comparison, there's estimated 20,000 to 36,000 deaths that occur on an annual basis in the United States from the common influenza virus.
Is there a vaccine against West Nile encephalitis?
Unfortunately, there is currently no vaccine for humans against West Nile virus. However, several companies are currently working towards developing a vaccine.
If there's no specific therapy, why should people see their doctor?
Although there is no specific form of treatment, oftentimes more severe cases may require intensive supportive therapy in which the infected person may have to undergo hospitalization to receive intravenous fluids or respiratory support.
If a person contracts West Nile virus, does that person develop a natural immunity to future infections by the virus?
Yes, at this time it is believed that a person will develop a lifelong immunity to the virus.
Okay. Well, thank you very much, Ms. Teodoro.
Oh, thank you.
That was very informative. Now we'll hear from Dr. Cassie Jones, veterinarian at the Point Vicente Animal Hospital, about the West Nile virus as it relates to animals. Hello, Dr. Jones.
Hi, Jessie. How are you?
I'm good. So, what animals get the West Nile virus, and how do they get it?
Well, animals get the West Nile virus just like people do through the bite of a mosquito. And the types of animals that can become infected are actually quite a large number, but the ones that we deal with most and that would get the sickest would be horses. Horses are particularly susceptible, although dogs and cats are also able to be infected, but the odds of them getting sick are very, very slim, almost incredibly remote. The chances are almost none that your dog or cat would ever come down with an illness. Birds, of course, can get infected too. That's one of the ways we know about the virus in an area, because crows are dying. And so obviously crows are very sensitive, but pet birds are also susceptible to the virus because of the mosquito bites.
What symptoms would alert an owner to take a horse to the vet?
Well, since horses are the most likely ones to show signs, the horse owner should watch out for a few things in particular. Mostly their horse's walking ability. Are they stumbling or tripping or circling, very depressed? Signs like that might relate to the nervous system. They don't typically run a fever, although some of them could, but they'll have difficulty walking, most likely.
How does the virus harm horses?
Well, it gets the ones that are particularly affected by it, and once they show signs, the horse will very likely die once they start the tripping and stumbling. But it gets into the nervous system, and your nervous system is your brain and your spinal cord, of course, and all of those nerves come down to your arms and your legs, so that's why you see those signs in the horses, tripping and stumbling, circling, those sorts of things.
Do any of the equine encephalitis vaccinations protect horses against West Nile encephalitis?
Well, there are a number of encephalitis vaccines for horses. There is one in particular for West Nile, but it's not the ones that your horses were usually getting before. There's a new vaccine now for West Nile virus in horses. And it's interesting you should ask about that, because recently there have been some reports of some horses who were vaccinated by their owners coming down with the disease. The USDA has approved several vaccines in horses, and those are available through your veterinarian. But there have been vaccines that are not approved, sold in feed stores, and people have been buying them and trying to vaccinate their own horses. Some of those horses are getting sick. So it's very important that you see your veterinarian if you suspect, or if you're in an area where West Nile is a problem. It's usually a series of 2 vaccines initially for the horse, about 3 to 6 weeks apart. Your horse's veterinarian will know which way to go on that. And then it's an annual booster. So if your horse got vaccinated last year, you should get boosted again this year. The vaccine should not be used in other animals, though.
If a horse gets West Nile virus, what can be done to reduce the chance that other animals or people would be affected?
Well, if a horse gets West Nile virus, you know he got it the way the others would typically get it, and that's through the bite of a mosquito. And so reducing the chances of other animals getting it means reducing the chances of them being bitten by a mosquito. Just as you would for yourself, try and keep susceptible animals away from mosquitoes in the early morning hours and the evening hours. Birds particularly can be susceptible. Obviously crows it can be fatal to crows, but I would keep pet birds indoors during those hours. The horses, try and limit their exposure to mosquitoes by eliminating the source of water, which is the breeding source for mosquitoes. All kinds of standing water, the horse's water bowl, streams, buckets, those kind of things should be emptied and changed at least daily to keep the water fresh so mosquitoes don't start to breed. There are some products you can use to repel mosquitoes. On people, there are mosquito repellent products that contain the ingredient Deet, but you would not use those on a dog or a cat or a bird, for example. There is a product out now that you can apply to dogs that does repel mosquitoes, and your dog's veterinarian will know about those. It's not made for cats, and it's not made for horses. I've never heard of it being used in horses, but I know it's not to be used in cats. But your veterinarian will know about that. And then prevention, of course, for the horses with the vaccine is critical.
Well, thank you very much, Dr. Jones.
Okay, you're welcome.
Now we'll break for a public service announcement. When we come back, we'll hear from Don Galante about treatment of the West Nile virus.
Are you interested in video editing, animation, good with computers, between the ages of 12 and 18, or just want something interesting to do after school? If you answered yes to one or more of these questions, visit our website address displayed on the screen. You'll be joining other interns with similar interests and learn using some of the most up-to-date technologies in the business.
Hi, my name is Richie Hakeem, and I'm an intern for Pals Birdies on the Net. So far, I've learned how to use Avid, SoundForge, and work on live video productions. These hours of internship help me get the hours of community service for school and other organizations that I need.
By becoming an intern at PV on the Net, you will learn about what the show makers go through when making a story or show, the basics on how to use Avid and other applications while boosting your knowledge of how computers work and showing what you're capable of doing.
If you're just joining us, this is Be Prepared. Don Galante, an infection control nurse at Little Company of Mary San Pedro Hospital, is here to discuss treatment of West Nile virus symptoms. Hello, Ms. Galante.
Hi, how are you?
I'm good. How are you?
I'm very well, thank you.
So, how does the virus actually cause severe illness and death in humans?
The virus causes meningitis or encephalitis, which is basically an inflammation of the brain and the central nervous system.
If you get sick, what symptoms would alert you to go to a doctor?
Well, West Nile virus can cause symptoms that are very similar to a lot of other viral illnesses, things like a headache or a fever. What would alert you to go to the doctor is if you have more severe symptoms, or to contact your doctor. More severe symptoms would include a very high fever, a stiff neck, even some altered mental status, meaning some confusion or disorientation.
How do you determine whether a person has West Nile virus or something else?
There are tests that can be done. There are blood tests and also tests of the spinal fluid that would test for West Nile virus. But those test results usually can take anywhere from 72 hours up to a week, possibly even longer, depending on where the test is being done. So a lot of times the test results are not going to be available until after the person has recovered.
What would be normal home care for somebody with symptoms?
Normal home care would be treatment of the actual symptoms, treatment of a fever with the usual things, Tylenol to bring the fever down, fluids. If you had any nausea or vomiting, you would treat those symptoms as well. A lot of rest, the same type of things that you would do for any other type of viral illness like the flu or a cold.
If a woman has a baby and she thinks she might have West Nile virus, should she continue to breastfeed?
The answer is yes. There has so far only been one case of what is believed to be a transmission from a mother to an infant via breast milk. The chances are very small, and the benefit of breastfeeding is so much greater that really all of the experts are saying to go ahead and continue breastfeeding.
How are patients with West Nile virus handled in a hospital?
Well, in a hospital, they're handled just as any other patient with a virus would be handled. That is, because it's a virus, the virus cannot be treated with an antibiotic. Antibiotics are used to treat bacteria. So it's not like you can give an antibiotic to get rid of the virus. It's mostly going to be supportive and treating the symptoms. IV fluids. For someone with more severe symptoms where they're having a lot of inflammation, they may give some sort of a steroid to decrease inflammation. But it's mainly supportive care.
Is the West Nile virus a seasonal virus?
West Nile virus goes along with mosquito season, which is basically spring, summer, and even into fall. Right now, experts are expecting that the mosquito activity and West Nile activity will peak in the month of September. So the worst could continue to be and yet to come. It should start to taper off by October. Mosquitoes do hibernate during the winter months, so that's why there is very little, if any, West Nile virus activity during the winter.
Have there been any cases in the South Bay?
There have been reported a total of, as of Wednesday, August the 20th, there have been 93 human cases in Los Angeles County, and even as far as South Los Angeles. There have also been reported cases in Long Beach as well. So it's moving this way.
How many people actually get sick?
Well, about 80% of people who become infected with the West Nile virus will have absolutely no symptoms whatsoever. They'll feel perfectly fine. Up to about 20% might have the milder symptoms, which is the headache and the fever. And only about 1 in 150 will actually become severely ill and probably need to be hospitalized.
How long does it take for infected people to get sick?
From the time a person is bit by a mosquito that carries West Nile virus, symptoms won't actually show until maybe anywhere between 3 and 14 days.
Where do the mosquitoes get the virus from?
Most of the mosquitoes are getting West Nile virus from birds who have become ill and died from West Nile virus. They are much more susceptible. The birds are much more susceptible, and specifically they were talking about crows. But birds in general are much more susceptible to the virus, and so they will become ill and die. Those dead birds are fed on by the mosquitoes. That's where the mosquitoes get it. And then the mosquitoes bite humans and pass it on to humans as well.
What do you do if you find a dead bird?
Well, the number one thing to do is not touch it with your hands. You don't want to be exposed to anything that dead bird might have. There are still some areas locally that are doing surveillance. That means they're watching for dead birds to help them track the virus. Some areas, the health department may come out and actually pick up a dead bird as part of their surveillance. But there are a lot of areas locally that they have already confirmed the virus in dead birds, so they won't pick them up. But if you're not sure, you could always call your local health department, or you could call vector control as well.
Thank you for coming in.
You're very welcome. Thank you for asking me.
You're welcome. That was very helpful. I'm Jessie Tisdale. Thank you for watching Be Prepared, a joint project by PVNet and the City of Rancho Palos Verdes.
Be sure to visit the City of Rancho Palos Verdes website at www.palosverdes.com/RPV.